We need to ask you about your TMJ. Do you know what your TMJ is? Dr. Frank Hernandez certainly does, and as an experienced dentist, he knows it can be the almost instant answer to relieving mysterious pain in other parts of the body. You'd never guess what your jawbone is connected to.
TMJ is the temporomandibular joint. It's the temporal bone of the head. It's the mandible, which is the jaw, and that's the joint that two bones come together. It's the most superior joint in the body, and I believe that in dentistry and for a lot of other medical situations, it's the absolute foundation of what is going on with the human body. A lot of times the joint is not in a position where it is favorable. It's in an imbalanced position. So, for example, the jaw is sitting like this in the jaw joint, or it's back, or some sort of orientation in the head where that's going on. A disorder for that joint would encompass a very great amount of symptoms. Head and neck pain, lower back pain, sleeping disorder. You could be a patient suffering from a lot of body pain and you might not find out. You might be chasing all around, all kinds of different doctors going on there, never finding the problem. The body's got to stand on its 2 feet. If you have a joint that's dysfunction, and I don't care where it is, the body's going to make some sort of accommodation to stand up. So it's going to contort, it's going to move, it's going to do certain things that it has to do to accommodate that body balance. And if your TMJ is off, there can be a lot of things off from that. Your spine can get twisted, your hips can change, your feet, there's going to be a lot of things going on there for the body to stand up on its own 2 feet.
Well, I was suffering from shoulder and neck pain, very severe. I went to emergency room one time, and all they did was give me a shot and some pain medication. Told me just to put some ice on and go away, and I went to a neck and back specialist for a little while, took an MRI, got no answers there. For 2 years I went to physical therapy, I did acupuncture, I went to a chiropractor. I mean, you pretty much said I did it all. I hit the door, he did a few simple tests, some tests, I took x-rays and photos and some sound tests of my jaw. He did some simple movement tests to see how I'd react, and then he said I had TMJ. I was suffering from TMJ. I was a little skeptical at first. I didn't think it would work. I didn't think how my jaw would affect my neck and my back and all this pressure in the back of my head. But at that point, I really didn't care, so I just wanted to come in and try it. So it was worth a shot. At that point, I was willing to do anything.
What we're going to do is we're going to orthopedically correct that. We're going to make something to bite on that you're going to correct that bite.
He put a little splint in my mouth, and this ortho splint I put in my mouth, and it kind of just moved my jaw, set it correct a little. It set my jaw correct, and all of a sudden I felt better. It was almost instant. Like my neck pain started minimizing, started going away. I felt the pressure from the back of my head instantly go away, and I knew it was working. I've been a patient less than a year, about 8 months. I feel great now. I'm starting to go back to the gym like I used to, taking care of myself physically, and I'm able to concentrate. I go to school too part-time, so I'm able to sit there and concentrate like I never was before. I'm able to focus better. I was just really excited that it actually worked for once in my life.
I've always had headaches in my temple that I associated with stress headaches and other things associated with it. And when I came to Dr. Hernandez, he checked me for the TMJ, and he said that was probably associated with my headaches. So as soon as I was fitted with my bite splints, my day splint and my evening splint, I noticed an immediate improvement. My headaches were gone within a few weeks.
One of the basic things that we use is a splint or an orthotic device. Well, I guess the way that everybody can take a look at that is it's very similar to what a night guard looks like, or a mouth guard. But it's a lot more sophisticated than making a piece of plastic on top of your teeth. And then at night, it's a whole different process because your nervous system changes at night. It shuts down. It's on automatic pilot. So other types of situations are involved with that. So you need to make a device for that so that way the patient can relax at night.
I'm amazed at how well I feel. Just amazed at how fast it could work too.
I've been amazed at the treatment where we've seen patients really turn around in 24 hours. But everybody's different. It may take months to see that correction turn around. You can make a diagnosis from just a clinical examination on that, but I don't think you're going to be very accurate. We use a variety of instrumentation here. We use a joint vibrational analysis, which the more noise that a joint makes, the more sick it is. The most accurate device out right now is using a CAT scan, which is what we have in our office right now. There may be practitioners out there that everybody that comes to their office that they're going to treat, and they're going to treat with a TMJ treatment, and that might not be the right thing to do. The thing that I'm going to do is that I'm going to make an examination for that patient, and I'm going to see what's going on with them and make that determination as to whether is that the number one problem that their nervous system is calculating. You know, I know somebody very, very close to me that has this problem. A completely broken down jaw on the left side, and it's me. You know, I went through this treatment. I'm wearing a splint right now in my mouth. I couldn't hold my head up. My head hurt so much that it hurt to work. And I really came to a point where I thought, am I going to have to give up my career because of this pain that I'm going through? And I just had these nagging, persistent headaches that really knocked me out. And it was a problem. And so, you know, after seeking out treatment, I'm in class and I'm going through my manual and I'm looking at all these things that are being presented to me, and I'm saying, that's me, this is what I've got.
And you don't even realize that it has to do with your bite, with your jaw, and it affects your whole body because it could misalign your whole body, your whole back. I'm just amazed at how well I feel. I no longer have headaches in my temples at all. Never. I haven't had one headache there ever since I came here. Not one. And I always thought it was just stress. And it wasn't stress, because I still have stress.